My name is David Boyer. I'm a retinal surgeon. I'm from Los Angeles. I'm a senior partner in Retina-Vitrieous Associates and an adjunct clinical professor at USC.
Welcome. Can you tell us about what you presented here at AAO this year?
This year I had the pleasure of presenting the Retina-Vitrieous data for the treatment of dry macular degeneration. And as you know, there are many dry macular degeneration trials that are ongoing at this time. This is a little different. Most of the trials previously were treating geographic atrophy. In this case, we were treating intermediate AMD with visual loss. And the results were pretty astounding. What the study consisted of is giving one injection of Retina-Vitrieous at week 0 and then repeating it at week 16. In the sham group, the patients received sham treatment up to week 16, and then they also had a crossover at that point, and everybody received treatment. The primary endpoint was the comparison in the active treatment group from a baseline to week 28 versus baseline to week 12 in the sham group. It was very interesting. 48% of patients gained 8 letters of vision in the treated group versus 7% of patients in the sham group. Now, when you think about this, you would wonder what happened to the patients who crossed over at week 16. How did they do at week 28? And indeed, they doubled at that point from 7 to 14%, showing that there was a definite improvement, but they couldn't catch up because of the delay in getting treatment. These are patients that did not necessarily have geographic atrophy. These are patients that had drusen pigment alterations, but did have the central OS-IS junction under the fovea to be intact. This carried out both for 2 line gainers, 10 letters of vision improvement, as well as 3 lines of visual improvement. The safety of this drug has already been tested with over 1,000 injections being given for various conditions, including wet AMD, diabetic macular edema, and the efficacy, I think, was significantly shown in this study. So this is a very important study because this drug acts in a variety of different ways. It reduces oxygen to species. It's anti-inflammatory at the level of C3. It also improves mitochondrial stability or reactive oxygen species, so the cells remain viable longer. And this has been shown in other studies that have looked at mitochondria, such as the STEALTH study that showed visual improvement in their patients receiving treatment to improve the anti-cardiolipin in mitochondrial disease patients. So I think that this is a big breakthrough. I think that this treatment hopefully will be carried out to a phase 3 trial in the future and hopefully will benefit a lot of our patients.
So what do you see as the next steps in this line of research?
Well, the next step is to design the phase 3 trial. I think we're learning much more about a biological marker which may help enrich the study and show us which patients can really be benefited from this. I don't want people to walk out thinking, you know, they have central GA, they're going to get this drug and have an improvement. That was not shown. It wasn't even tested for. This is for patients with intermediate AMD who have had visual loss because the treatment was 24-year patients or worse. And that's a select group of patients who don't have geographic atrophy. And so getting this study repeated in a large phase 3 may give hundreds of thousands of patients an improvement in their overall vision.
How can people follow your research or get involved in these clinical trials?
Well, I think that, you know, the trial hasn't started for the phase 3. Right. So when it starts will, you know, obviously depend on, you know, when the agreement between the authorities and the company can be made so that we can get a firm trial protocol in place. And there will be enough notice that for enrollment in this trial. And certainly, you know, you can ask your eye care professionals, you know, to bring you up to date. You can go to clinicaltrials.gov and look up what trials are available. This trial probably, at the rate it's going, will probably start enrolling in the first quarter of next year.
Will Will this phase 3 trial be enrolling only in California, or can we look for it nationwide?
Oh, no, this is definitely going to be a nationwide study. There'll be access in virtually every state. There'll be hundreds of centers to provide care so that people don't have to travel as far. It will not only be in California, but it's going to be all throughout the country.
Are you working with a particular pharmaceutical at this point?
At this point, the company has done all these studies without a pharmaceutical partner. There are several companies, however, that are looking to possibly aid in the phase 3 and possibly partner with them in the future.
Is there anything you'd like to add or close with?
Well, no, I think it's a very exciting time in ophthalmology. We have gene therapies that are coming out. We have this trial that's treating earlier than we usually do, which I think is when we have to treat. It's very hard to tell someone you need to be treated when you have good vision to prevent you from developing bad vision. But I think in the future, as drugs become safer and less frequently injected, and this drug needs to be injected every 12 weeks, so 4 times a year, is relatively reasonable to come in and get checked to make sure you don't have any other problems. So I think it's an exciting time to be in retina. I'm hoping that we have these cures in the next several years, or at least can help treat patients to reduce visual loss.
Thank you so much, Dr. Boyer. It's always a pleasure.